are people asking about the Affordable Care Act and what's coming and what benefits they might get? What does the knowledge level seem to be out there with patients?
We definitely are getting a lot of questions. Some people are a little bit more informed about the complexities of the law than others, but actually was just told today by our we got a federal grant to hire several navigators who are people who will help anyone, whether they utilize our providers or not, help them navigate the exchanges which would go live in a week, in which are marketplaces. I describe it as sort of an Amazon.com type of site where people can shop and compare plans. So I found out today that yesterday at our largest community health center, Straka Terrace, which is a 40,000 square foot family practice center on the south side of Oklahoma City, an individual came in yesterday asking about the exchanges, and our front office person explained that they're not available to enroll yet, that our navigators will be available in about a week. And the word I got was that this individual started to cry and said that he and his wife have such mounting medical bills that they really are anxious for it to get going. He was more upset that the fact that the plans would not go into effect until January 1. He could wait a week to enroll, but he was anticipating that the plan started October 1st. So that's just one anecdote of, obviously there are some people out there that are anxious to sort of wrestle with it and see what sort of access that they may get that they previously don't have. So.
Mm-hmm. Terry, speaking of getting information out there, as Oklahoma Watch, we had a story not too long ago about how the state is not really taking a lot of proactive steps to reach out to people. Up in the state in Montana, the insurance commissioner up there is traveling the state conducting town forums, declaring that there are no partisan purposes, simply want to give people the information to make the right choices. Even the State Department of Health website here has a very nice looking web page. All the links go straight to the federal site that we've seen. And should the state be doing more to reach out to Oklahomans to tell them what's coming in 1 week with the arrival of this health care marketplace?
Let me explain a little bit about what the state is doing. And I can't speak, of course, for the insurance commissioner, but I can speak for what we've done in my area of state government. We have, in part, waiting for additional information. We have, so I'm the Cabinet Secretary for Health and Human Services. We have convened all of the Health and Human Services agencies, which are the agencies that are most likely to get those questions from individuals. We have, just within the Department of Health, it's kind of to the clinic question, we have 69 county health departments spread across the entire state. We are getting those questions. People come in the door. They're used to being able to ask whatever question that's health related right there, because that's an entity that they're familiar with in their particular community. We have not received federal funding to disseminate this information or push this information. The federally qualified health centers have received some of that through HRSA, which is one of the federal agencies. There are entities across the country that have, just within the last month, I guess, August 15th, were notified of their awards to take on that educational role in communities, receive large grants to push that information out across the state. We were not one of those entities. There are two within the state of Oklahoma, two grantees that were awarded that money. But when we convened the Health and Human Services Cabinet agencies, as Andrew said earlier, these issues are incredibly complex. And we don't know all the details, and that information is emerging almost on a daily basis. People who have been trained are receiving that training to be the navigators, to be the certified application counselors. They're just getting the tip of the iceberg, so there'll be a lot more information coming. So we really see as one of our primary roles, and the governor has been very, very clear. She wants to make sure people get this information